Examples of humanistic theory and client-centered. A humanistic method is boosting self-esteem and would involve motivating an individual to pay attention to their qualities instead of their flaws. The individual can strive towards living a more fulfilled and full life by concentrating on their strengths and developing on them. Research has shown that client centered social workers will not attempt to explain what a patient has gone through. Instead, the social worker will pose inquiries to aid clients in developing a deeper understanding of themselves. A way that you can be more client centered practice while working with a diverse communities and populations is one, by being open minded when you meet the person and when you're working with them. Two is making sure that you're using the right pronouns and the right name they want to be called by making them feel more comfortable. Two is being aware of cultural difference between your culture and their culture. And also being aware of their language and the practices that they have. By doing those types of things, you will be able to work on your client's goals, which is very client-centered practice and humanistic theory, by boosting their self-esteem and just being very culturally aware, will help you better be a social worker and also work with multitude of diverse populations. Client-centered care and humanism, first and foremost, believes and upholds the individual. The theory closely aligns with NASW's mission and values because both respects, honors, and values individual connection and the therapeutic relationship. Additionally, the theory believes in the individual's capacity to change. This theory is very optimistic. Client-centered care honors the client's autonomy and self-determination. Clients are the ones who take the lead in their wellness journey. Another strength of the approach is that it's collaborative. The approach refrains from using top-down intervention. Clients are the expert of their own lives and are capable of change. In client-centered care or humanism, the therapist allows the client to make decisions and mistakes if necessary. Long-lasting change happens when the client is directly invested in and involved in the process. Client-centered is a way of being in the therapeutic space and therefore can be applied to all levels of practice. In micro-practice, the therapist would show empathy, compassion, unconditional positive regard, and lean into the pain of others. In meso-practice, that might look like the relationship with family or agencies would be one that is supported. And even working with communities around policies, this approach would be strength-based and collaborative. In all these areas, the relationship and connection is key to progress. Because client-centered care and is strength-based and collaborative, there is room to incorporate the person's culture and resources into their treatment. There's a deep and sincere appreciation for the person's experience, thoughts, and beliefs. This empowers and builds up the client's self-determination and self-esteem, which impacts their ability to change. Some of the limitations of client-centered care is that it's broad and difficult for scientists to test. That's not to say that the approach is not effective. It's just hard to measure success and outcome. Client-centered care is non-directive, which can make documentation challenging. The client is the one that leads, which is a shift from a more traditional type of therapy. The intervention is engagement and the quality of the relationship, which is quite different from CBT or behavioral intervention. And lastly, client-centered therapy takes time. It can take a long time to develop an authentic and genuine relationship that allows the client to feel safe. We operate in a health system that has time constraints and requires certain outcomes. This theory runs counter to the theory and humanistic approach. Principle 1. Personal and social problems occur when people are devalued. According to humanism and client-centered theory, client problems are caused and exacerbated when people feel devalued and when they lack power and control of their lives. Clients may also struggle with their self-image, which can have a negative impact on their satisfaction with themselves, relationships with others, and their mental health. Similarly, the client may experience maladaptive feelings and thoughts, which can have a negative effect on their behavior, which will ultimately cause low self-esteem and potentially even self-harm. How the client is treated by the social worker and their new environment can determine whether the valuing of self continues or is challenged. And this is why it's important for social workers to create a safe space for fostering trust and practicing a non-judgmental approach. Also, as social workers, we should prevent practicing oppressive treatment by consistently promoting a sense of inherent dignity and self-worth. This aligns with our social work value of the dignity and self-worth of a person. Being respectful to our client, being aware of any possible cultural or individual differences, and promoting self-determination. That leads to encouraging self-accommodation. This gives the client back the voice on the silence. And not only are they taking their power back, but they are able to make decisions and choices. And in this way, they're advocating for themselves. Lastly, build the client's self-worth and empowering them. By doing this, the client is making the best choices and decisions. In this way, taking the lead in their journey compared to the social worker or us doing it for them. Principle 2, change happens in the context of an authentic, healthy relationship. According to the text, change in clients is fostered not by techniques, but rather through the context of developing a professional relationship that is validating and communicates unconditional positive regard. Similar to Principle 1, this authentic relationship can be accomplished by creating a safe process in order for the client to begin working through their problems. This is when the healing journey begins. This is a non-hierarchical process where the client is the expert in solving their own problems compared to the social worker doing that for them. Instead, the social worker's responsibility is to establish an environment where the client can accomplish their goals and grow during treatment. That is why it's so important to establish a genuine therapeutic relationship and to validate the client as a person. There are times where a social worker's implicit bias may influence them to make decisions or communicate with the client based on thinking the client is incapable or their problems are inherent to their being, according to the text. But establishing rapport, along with creating an open and authentic helping relationship, plus creating a safe space and validating the client, will ultimately result in self-actualization. Principle 3 of humanistic theory is that people are capable of self-actualization when the conditions allow positive growth and change. Humans are naturally motivated for change and growth. People can process negative events of their past, learn lessons, and use that to create future goals. Self-actualization is a journey that allows humans to fully accept themselves. Social workers should create a supportive environment that can enable growth and foster change. And social workers can acknowledge people's differences and conditions while at the same time not limiting a client's potential. And then we also have a short video about client-centered therapy using humanistic theory as developed by Carl Rogers. Do you remember back in our lesson on motivation and emotion when we discussed Maslow's hierarchy of needs? And we talked about the top level of the hierarchy, which was self-actualization? Well, our next type of psychotherapy was developed by Carl Rogers, and its purpose is to help a client reach their greatest potential. So this top layer of the hierarchy, this is called client-centered therapy. This is a form of humanistic therapy, where the therapist shows unconditional positive regard for the patient, meaning the therapist genuinely accepts the individual and empathizes with the client, no matter what the person has done. The basic idea behind Rogers' humanistic therapy is that the mismatch between who people think they are and who they think they should be or would like to be is the source of their low self-esteem and problems. In other words, there's a mismatch between the real and the ideal self. The job of the therapist, therefore, is to be so accepting of the person that their real self and ideal self becomes one and the same. That is, they like who they really are and they accept who they really are. The end result of a successful treatment would be that the individual developed a strong sense of self-worth and that he or she has the confidence to strive for self-fulfillment.